Good morning to everybody, whoever is attending my lecture series on headache. Now, migraine is a kind of headache which is genetically complex. Studies of monozygotic and dizygotic twins have supported a genetic contribution to migraine. When the parents of patients with migraine with aura were interviewed directly, 91% of the patients had one or both parents with migraines. This finding suggests an autosomal dominant transmission. The rare syndrome of mitochondrial encephalopathy, myopathy, lactic acidosis, and stroke-like episodes, which is known as MELAS, MELAS, has been attributed to a mutation of the mitochondrial DNA. More recently, familial hemiplegic migraine (FHM) was linked to a mutation of chromosome 19 in 55% of familial hemiplegic migraine, that is FHM families. Later, the FHM in 15% of the families was linked to chromosome 1. In the remaining 30% of the FHM families, there was no linkage to either chromosome 1 or 19, supporting a yet to be defined heterogeneity. It is not clear whether common forms of migraine are linked to mutations on chromosome 1 or 19. In a minority of patients, behavioral symptoms occur during the day before a migraine, like euphoria, irritability, depression, hunger, thirst, and drowsiness are common. The nature of these symptoms is consistent with a locus of dysfunction within the brain, possibly involving the hypothalamus and limbic systems. In classic migraine, an aura, possibly caused by cerebral ischemia, precedes the headache. A zone of reduced cerebral blood flow spreads at the rate of approximately 2 to 3 millimeter per minute across the cortex and the spread of sensory symptoms across the limbs takes place at a corresponding rate. Often visual symptoms herald an attack. They may include scotomata and even hemianopsia, light and dark floaters, shimmering vision, defocusing, or alteration in visual perception, such as micropsia. Transient dysfunction of brain structures supplied by the vertebro-basilar circulation may precede the headache. These may include the vertigo, partial ophthalmoplegia, especially affecting the oculomotor nerve, transient amnesia, paresthesia, or weakness. Aphasia or other signs of insufficient anterior circulation may constitute the aura. The headache of classic migraine vary in duration but usually last several hours. There may be a throbbing quality to the pain. Frequently, the headache is unilateral. Now we come to the end of this part of the video series. Next part will come in the next video. Thank you.